Hello, welcome everyone. I hope I'm audible to all. Good evening, everyone. A warm welcome to all of you. We are now live on YouTube for IPWC webinar for today. Our esteemed speaker for today is Dr. Ravneet Singh, and he is going to enlighten us on physiotherapy competency exam for Canada. And I would request all the participants to please subscribe for our IAP India YouTube page. And for further updates, kindly follow our Facebook page. And if you have any queries during the webinar, please put it in the chat box. And this webinar is being conducted by IAPWC Maharashtra State Team. And as you all know, IAPWC is being headed by National Head Dr. Ruchi Vashne ma'am and our IAP President Dr. Sanjeev Jha sir, and our West Zone Head Dr. Pooja Kamble, and our Maharashtra State Coordinator Dr. Suvarna Ganveer ma'am, our Joint Coordinator Dr. Snehal Patel, and Sub-Coordinators Dr. Uttara Mohan, Dr. Priya Karande, and myself, Dr. Nirali Sangvi. So I would like to take the privilege to introduce our speaker for today, Dr. Ravneet Singh. He's been a very, very experienced speaker and a practitioner since almost 2016. He's done his master's from USA, and sir has been being a clinical instructor and a director of rehabilitation subacute care hospital. He is also the founder and instructor for PCE Final Frontier Canada. He's been teaching for NPTE and PCE since 2016. He serves as a Chief Information Officer for a non-profit organization. He also runs the most largest platform, Facebook platform for the physiotherapists for guidance for Canada PCE. And he's been a guest lecturer at multiple universities, been invited at Switzerland, at UK, and I think it is our good luck and privilege to have you here, sir. He's been also soon going to present at Dubai, wherein he's going to talk about the pass rates for foreign trained physios. So over to you, sir.
Thank you
Thank
so
you.
much, Dr.
Yeah.
Nirali. I appreciate
Thank you,
it.
sir. Welcome.
I think it's a privilege and it's an honor for every Indian physiotherapist. When we come to abroad, it becomes one of our bucket lists that we have to present to the IAP someday in a lifetime. So this is such a great honor, and I think I can speak from all the panelists that we have in my team here. But thank you all. Thank you, Dr. Snehal, for coordinating everything with us. I know sometimes I've been late with the replies, but thank you for your patience. Thank you, Dr. Priya and Dr. Savarna, for being here and supporting us. Myself, Ravneet Singh, and I think I don't have to say anything about myself anymore. I have two team members right here, Dr. Ruchi and Dr. Salesh, who are also Indians, and I think I can speak from them also that it's such an honor. And as I said, this has always been a part of our bucket list. Like when you come to outside of India, anywhere where you go, Dubai, UAE, US, Canada, it doesn't matter. One of our goal is to come back to India and present to and give something back to the communities that we come from. So thank you very much, everyone, for joining in. I'm going to share my screen and start talking about what we are going to present here. So please let me know once you see my screen here. All right, perfect. I hope everyone can see my screen. Maybe you can type it in the chat, yes or no. Yes, we can see your screen. No, we can't see your screen. I have Dr. Ruchi, who will be helping us in the chat if you have any questions. So feel free to type it in the chat, or we can help you answer your questions. Also, we have Salesh, who is our immigration expert. We'll talk about the immigration very soon. What are the best ways to come to the Canada, and because this webinar is all about roadmap to Canada and PC preparation, so our focus is to give you the easiest ways, the most economical ways to come to Canada. And I think how much better can it get when a Sardar coming on a screen and talking about the Canada? So I think it's always a privilege to I think, use those stereotypical jokes when you come back to your community, and most of the people can understand. While we are talking to all the Canadians and Americans, sometimes we want to make a joke and it's just passing from sides. Okay, anyways. So let's start it. First, I want to tell something about myself. Like, I've been serving the physio community for almost 10 years now. I graduated in 2013 from Khalsa College, Amritsar, and ever since I've become a member with IAP. And then we've been serving Indian physios, helping Indian physios. And when I came outside of India and then started working here and started a big community over here in the form of chief information officer, making nonprofit organizations. So I'm so honored to inform you that we are serving in the US also, and we are the only organization made by the foreign physios who are serving the foreign physios. So in future, we are looking at a very bright step. We are looking at very bright future and great steps taken by our nonprofit organization. I'm a founder of and instructor of the PCE Final Frontier, where we help physios all over the world to become physiotherapists in Canada. So far, we have a full-time team support in Canada, US, India, Philippines, and we are expanding in other countries as well. But as a part of multiple universities globally, IAP and Indian universities have been our top-notch partnerships to help physios to come to either Canada or USA. For the PCE Final Frontier, when we started, we had a mission that the struggles that we had to go through, the journey that we did on our side, and we didn't want a lot of other physios to make those mistakes. We didn't want other physios to go through those hardships. We wanted to make things easier for you guys. So everything that I'm going to show and everything that I'm going to share on the screen is only with one purpose, is only with one intention, that we're just trying to help you. Please don't take it as advertisement for any course, especially when we talk to the PCE Final Frontier. This is not what we are trying to do here. When we are collaborating with the IAP, we are promising the IAP that our team will do everything in our hands to make this journey easier for you guys. All right, so how this session is going to go, we're going to talk about the evaluation process, like what is required for you to come to Canada, what documents are required, how are you going to save your time and money while you're in India, or if you have come to Canada on student visa basis or travel basis, how is it going to be helpful for you to make easy steps for your evaluation. All right. The second thing we are going to discuss about the understanding of the blueprint, because everyone who is coming to Canada has to take a license exam. So without the license exam, you cannot practice in Canada. So we'll talk about what and how you can prepare for your license examination. Sailesh will be talking about the immigration and the aspects of the immigration, what are the different types of visas, and what is the approximate expenses. Honestly speaking, we can't tell you the expenses without looking at the case, but we can give you at least something that you can make a decision. Oh, this is particular my area that I want to work in, and this is my kind of investment for the time and the money that I can invest for next 2 years or 3 years, and then eventually go to Canada and start working in my dream country. And then we'll talk about what to expect in PCE, like what is the course overview, how much PCE that you have to score in, and what are the domains, how do you prepare. I do have some questions to solve with you guys. So just hang in there. We'll bring the questions and then we'll give you some tips how to prepare for your PCE as well. All right, perfect. Moving on to why PCE Final Frontier, because we are very proud to say that we are one-stop platform, which means once you get connected with us, we'll help you with your credentialing support. Our team will help you to understand what documents to be sent and what not, because once if you send any wrong information to the capper, the agency who evaluates your degree, then they send the verification document and it keeps adding at least 14 to 28 days every time they want a verification from you. So sometimes it gets very frustrating for a lot of people. And I still know a lot of people who are still struggling because some of their universities are shut down, some of their parents are not in the town, and they don't have the control of sending the correct set of documents to the evaluating agency. So we'll talk about what steps needs to be taken for the credentialing. And then once you're done with your credentialing, we'll give you the licensure support, which means we'll help you to pass the exam as well. I can connect with you hundreds of people who can vouch for it that it's important to have somebody on your side when you're preparing for the PCE, because coming from India, besides the ethical values, but the work culture in Canada is a lot different. The way I used to practice in India is completely different here, because the priorities and the regulations are completely different. So the ethical and the regulation aspect of the PCE, you really have to understand before you come here. So please do not fall into the trap of thinking that it's okay, I'm a PT already, I've practiced 10 years, I'm good with my physiotherapy techniques. Yes, you're good. Okay, one thing I want to tell you, and I feel very honored to say that, the way Indian PTs practice here, you cannot match that kind of practice. The way we are taught physiotherapy in our schools is completely different from what was taught in what is being taught here. Yes, they are teaching everything, but the kind of boldness and the grip that we have on our concepts is really good as compared to, I say, any other PTs in the world. And then once you take the PCE examination, we'll give you the immigration support. Sailesh, who is one of our experts, and I completely trust him on his decisions of choosing the employers for people and for the LMIA process, because there are a lot of frauds happening out there that we have noticed. Like, people will promise you, give me $4,000, I'll get you everything. Give me this much money and I'll get you in Canada. Please don't fall into those traps. There are a lot of people roaming in India, and they would say, give me this much money and I'll take you to the Canada. I get you the job. No one can guarantee anything. So I'm being very honest right now, which is why I want you to listen to Sailesh when he talk about the LMIA process, the requirements and everything. All right. Okay, perfect. Now, what are the steps to Canada, right? I think I'm going to invite Ruchi to talk about, because she's our content expert and she's been helping. I think she must have helped hundreds of students to understand the credentialing process and helping them to avoid the mistakes of the credentialing process. Ruchi.
Thank you, Ravneet. Good evening, everyone. I'm Ruchi and I practice as a physiotherapist in Canada at the moment. I've been part of Final Frontier, PCE Final Frontier, for a very long time now, and it's been a pleasure working with Ravneet and the entire team. I will be talking about different steps that you will have to take before you are able to come to Canada and practice as a physiotherapist. The Canadian Alliance of Physiotherapy Regulators is the regulating body for Canadians to work as physiotherapy in Canada. And you need to go through a credentialing evaluation process under them. There are several forms and several supporting documents that needs to be sent to CAPR, at least to begin with your credentialing process. Meanwhile, you finish your credentialing process is under steps. There are a few other things that can be done which can help expedite your process. One of that is taking a health course. So for anybody who is foreign trained, meaning anybody who has trained as being a physiotherapist, outside of Canada, be it any other country, they need to take a health course under the University of Alberta and University of Toronto, where they would have you go through different criteria of how the healthcare system works in Canada and what are the ethical scenarios and different expectations once you start working as a physiotherapist in Canada. There are several forms that needs to be sent. Briefly talking about Form A, B, and D. Form A and B with the supporting documents needs to be sent by the candidate. Form D is supposed to be sent by the college with the supporting documents. The transcripts are supposed to be sent mandatorily by your university, otherwise they won't be accepted. So there are some criteria that we need to follow. Once you are done with your credentialing process, the next step is to get yourself registered to write the PCE exam. Now you can take the courses I passed with flying colors under Ravneet's guidance, and it was an amazing experience. You would take the course. We have several free resources where you would even have an idea how the course functions, and we can always once you're done with your written component. So PCE has two components in order to be able to get started working as a fully registered physiotherapist. The first step is a written exam. Once you clear your written exam, you are eligible to start working as a resident physiotherapist in Canada, under different criterias. Be it there are different visas that can be worked through, and you can come to Canada and get started working as a resident physiotherapist. As Ravneet mentioned, we have Sailesh talking about the visa processes. So I would leave this part to the expert to talk on. These are the really basic steps that can be done for you to come to Canada. Moving to the next slide, what are different 5 steps that you need to get eligibility to start working as a physiotherapist in Canada? You need to open up your file with CAPR. CAPR is Canadian Alliance of Physiotherapy Regulators. So nothing is online. Everything needs to be done on paper. That's a really important thing for everybody to note of. There is a lot of confusion amongst the candidates who are new and who don't have an idea. Nothing can be done online. Everything needs to be sent via courier to the Alliance. You'll be sending your documents. One of the important document is to send your degree certificate and the internship hours, where the minimum of internship hours are supposed to be 1025 hours. Those hours usually would get divided with your internship that you do, or between the clinical hours that you do during your third and the final year of your physiotherapy school. Once your documents are in, you would be receiving an email by CAPR where they would be talking about the Canadian healthcare system, the courses that can be done and should be done, without which you would not be getting your eligibility to be able to write your written exam. So that's usually under University of Toronto and University of Alberta. The courses are extremely easy. They are self-paced. You can do them at your own time once you register it, and you would be provided with the certificate, or your expert from CAPR would be directly communicated regarding you fulfilling all the criteria with the course. Once you're done with that, you will have to pay for your PCE. You would be basically getting an email from CAPR again that you are eligible and you are ready to write your exam. There's a 4th point really important. Now, since COVID hit, CAPR allows to give you exam from your home country. No matter whichever part of the world you are sitting, you will be able to give your exam. So that's amazing thing for people coming internationally to at least give their exam from their home country, become the resident PT, and then come to Canada. That might not be possible in every situation, but if it is, this is one of the really good options a lot of our students have done, and we have had them get a job and move and everything from there. Once you're eligible to take your exam, and you can move forward, get yourself registered, take the PCE, pass the PCE, ace it, and move forward towards the next steps. I really hope this information was useful for everyone. We will be more than happy for everybody to talk to send in their questions in the chat. Moving forward, we are also mentioning about some current financial estimation. These are really just the estimates, and it would depend from person to person for some charges. So the first one is getting prepared, wherein you have to send in your documents to CAPR, and they would be done in different sets. All the documents cannot be sent at once. They're supposed to be sent by different bodies. For example, yourself, your college, and the university. And the amount would be somewhere near 500 Canadian dollars. The credentialing fee would remain same for everybody, which is 1,415 Canadian dollars. This would remain same for everyone, so this wouldn't change. The courses at the University of Toronto or Alberta would vary within 550 Canadian dollars. And the exam fee just for the written component is $1,368. So there is a total estimate somewhere between 3,800 to 4,000 Canadian dollars that we can be prepared in order for you to become resident physiotherapist in Canada. I really hope this information was useful, and please feel free to drop your questions in the chat, and we'll be extremely happy to help and serve to the best of our capabilities. Thank you. I will hand it over back to Ravneet, and we will move forward from there.
Thank you so much, Dr. Ruchi. I think this whole webinar is live streamed on the YouTube, and this information will be available to you always. But if you have any questions, you can always reach out to us, and just have to go through the contact support@pceff.com, and we'll give you more information if it is required. I do have the emails by the end of the session, but I think it's time to look at the PCE preparation guide. A lot of people believe that you need at least 1 year to prepare the exam. You need at least 2 years to prepare the exam. I've worked with people who have passed the exam in about 3 months of preparation, 6 months of preparation. So it really depends on how much time you have in your hands and how are you planning with your PC preparation. Are you a full-time worker? Are you working more than 10 to 12 hours? Or are you a student right now, and you have a lot of responsibilities on your shoulders when you come to Canada, and you only have 2 hours to study, or you have good family support, you don't have anything to do anything else than preparing for the PCE. But let's look at what exactly the PCE looks like. The PCE is basically the license exam, which helps you to start practicing in Canada, and it has a written component and the clinical component. For now, the clinical component is not being done in person the way it was before COVID. Now, the clinical component is done depending on the province that you're choosing, and they have a separate exam, which is going to be online exam for your clinical as well, which means you don't have a patient to work on, but it's more of the ethical and the scenario-based question answers, where you have to write the most ethical way to work with your patients. For the written exam, the passing score is going to be your 600 out of 800. So there are almost 200 questions on the exam, all multiple choice. I'll tell you what kind of questions they're going to ask. And then you'll just have to score 600 out of 800, which becomes about a range of 70 to 75% in the PCE written. If you get that, you are good to go to start practicing as a physiotherapist, and you have to take the clinical exam to become the fully registered physiotherapist in Canada, right? All right, let's move on to the domains and the blueprint understanding. Now, the questions that come on the PCE are based on a lot of different varieties. They are based on not just the physiotherapy expertise, which includes anatomy, physiology, you have your conditions, MSK, neuro, you have your interventions, but it also consists of 4 different domains, which means if there are questions on the MSK, musculoskeletal, which we call ortho in India, would be 50 to 55% questions on that. For the neurological disabilities or impairments, they're going to be 20 to 25%. For cardiorespiratory, 15 to 20%, and other systems, which includes the metabolic disorders, your orthotic devices, assistive devices, adaptive devices, your conditions like cancer. So all other conditions besides MSK, neuro, and cardio will be considered under the other systems. So you're not just preparing yourself for the physiotherapy expertise, which are going to be your 55% questions, but they can ask questions on how do you communicate well with the patient? What are the communication skills and components into the physiotherapy according to the ethical practices? How do you collaborate? How do you write a referral to the physician or any other discipline like occupational therapist, speech therapist, physician, any psych consult? How do you collaborate with them? How do you manage the patients and the team? Your leadership qualities, your scholarship, your professionalism, all these questions comes into one category, which we called ethics. All right. Every province have ethics material given on their website, but we will give you the PDF, which includes the most important ethical issues that should be asked in the exam, and that should help you become a good Canadian physiotherapist. All right. What are the domains that Blueprint talks about? Now, these are the topics that is given under the Blueprint. Like, what are the topics for the MSK? These probably 15 to 20 topics, but that does not mean that you're only going to study this much. For example, now I'm going to give you a little bit of more information on how exactly to study, right? If the Blueprint says muscle contusions, strains, tears, and weaknesses, that doesn't mean that you're just reading about the tears. That means anywhere in the body, if there's a muscle contusion, you should know how to prevent that injury to aggravate. You should know how to immobilize that part. What is the particular position that you're going to immobilize the part? Now, in order to understand the questions and in order to answer these kind of questions, you should be very good with your basics, like your anatomy, your biomechanics, your closed pack positions, your open pack positions, your loose pack positions, all kind of stuff, your capsular patterns, so that you can provide recommendation to the patient that does not hurt and that basically enhances the healing of the tissues. So which means that your basics needs to be very strong. PCE questions can go from very basic, like they can literally ask you like the action of the muscles. And it can go to the advanced structures. For example, if a patient has the meniscal injuries, what movements are you going to limit in the first month post-surgery meniscal injuries? So once you enroll into the course, we'll help you and we'll give you everything to study. But now let's move on to the types of questions that can be asked under the PCE. There are two kinds of questions. One is vignette style questions. In these kind of questions, you have one scenario and then you'll have two or more questions on that. Every question is MCQ. There's no subjective questions. So every question has 4 options. So when you have a vignette question, you have a stem up there, and then you have certain questions which are connected with that stem, and then you have to answer connecting the question that is being asked and the main stem that you have. I'll show you some samples of the questions as well. And the second type of questions are going to be standalone questions. Standalone questions basically means that there's only one stem and there's only one question that is being asked. If you go with the ratio, out of 200 questions, I think almost 160 questions are going to be your vignette and no more than 40 questions for the standalone questions. This is not talked on the website or anywhere, but this is from our experience that almost like 75% of the exam or 80% of the exam comes through the vignette style questions, which kind of easy because it's only one particular topic and then you have to answer questions on the base of that particular topic. But yes, it can have interconnections with the other topics as well. I'll give you some examples right away. Right, perfect. Let's try something else. Can anyone type it in the chat? Anyone who is not panelist but attending this session, can you try to type something in the chat so that we see we are receiving your messages? All right, so the next thing is that I'm going to show you some questions and I'll talk about those questions. I'll give you about 1 minute to solve each question and then I'll give you the explanation. All right, perfect. So this is your MSK vignette first. So when I say vignette, that means it has a stem up here. And then depending on the stem, then you have 2 questions on the topic related to these questions. All right, so take about 1 minute and then I'll start talking about how to solve this question. the best way to solve these kind of questions is to read the question first, but not the stem, because if you're reading the question first, it gives you the goal. It helps you to retain what is being asked. For example, the examination shows positive test results of the anterior drawer test. Which of the following structure is likely injured? Now, according to my information, the anterior drawer test can be done in two different joints. One is the knee joint, and then is in the ankle joint, right? But how do I know if it's related to the knee joint or the ankle joint? I'm going to read the main stem right here, which says a young athletic patient comes to the physiotherapy clinic with significant swelling around the lateral ankle. So that means this anterior drawer test is related to the lateral ankle. Radiographs of the ankle reveal no evidence of the bone injury. The patient's mechanism of injury consisted of twisting his ankle on the planted foot. Now, this is a very typical ankle sprain question. I know that the anterior drawer test is positive. I know that there was twisting. I know that their radiographs are negative, which means no bone is fractured, right? If no bone is fractured, that means mostly it's the ankle sprain. Ankle sprain means the ligament is being injured. Now you have four options and you have to choose something out of these four options. Is anterior drawer test done from Achilles tendon, fibularis peroneus brevis tendon, calcaneofibular ligament, or anterior talofibular ligament? All right, as I said, now in your brain, two things should be acting very quickly. The anterior drawer test, what structure it is done for? It is done for the ligament. All right. Now, if it is done for the ligament, the two options that I can eliminate out of these particular question is the tendon options, right? Option A and B can be eliminated. So I only have to think about option C and D. Now, anterior drawer tests, or if I say the most typical ankle sprains, would show you the symptoms of the calcaneofibular and the anterior talofibular ligament both. But which ligament confirms through the anterior drawer test is option D. So option D is going to be your correct answer. Now, in other cases, if you want to clarify and if you want to make a very rigid answer on the calcaneofibular ligament, then you can perform the talar tilt test. Right now, this is like one of the most typical questions and one of the most basic questions. It's being asked on a ligament. The test is given to you. The question can become in the form of the ligament is given, and then you have to choose the special test out of it. Or the ligament and the test both are given. Now you have to choose the mechanism of injury out of the question. So the question can be formed in any other way, but if you know the topic, you know things around it, you should be able to answer those questions. Let's read question number 2 under the MSK. Due to unbearable pain, the patient stopped moving the ankle. Upon examination, therapist notes a limitation in passive ankle dorsiflexion with firm end feel. This is most likely explained by. Now you have few things given in the option: the type of the end feel and the direction of the movement, or the movement which is being restricted. If ankle dorsiflexion is restricted, either the muscles are tight or there are any bony deformations occur in that particular joint. So what is firm end feel, and how do you make a decision out of these four options? Gastrocnemius soleus complex shortening, anterior talocrural joint capsule tightness, anterior tibialis atrophy, and tibia talus bone formation. Now, in order to solve this question, you need to know the types of the end feel. For example, is this end feel soft, firm, hard, mushy, springy, empty? Now, if you talk about the hard end feel, that means there's a bone involvement. For example, myositis ossificans or osteitis in the bone that causes the hardness in the end feel. Firmness can become can cause by the tight structures. And soft is usually the normal end feel, which is usually seen with elbow flexion and knee flexion. But here, ankle dorsiflexion is restricted, and the firm end feel. The most easiest way to solve these questions is to start eliminating. I'm going to eliminate option D because it talks about the bone approximation and it does not match with the type of the end feel right here. All right. The muscle atrophy are not tested with the passive range of motion, and the end fields can only be done with the passive range of motion. So this option is also wrong for me. I don't want to go with that. Now I have two options. Both of the options shows firm end feel: gastrocnemius soleus complex shortening or anterior talocrural joint capsule tightness. Now, if there's a structure, let's say if I have a structure, if you all can see the bones in my hand, if there are structures anteriorly which are tight, they're not going to cause limitation in dorsiflexion. They are going to cause limitation in the plantar flexion, which is why option B is also wrong for me, because option B will cause limitation in the plantar flexion. Now, this brings to me option number 1. Option A, gastrocnemius soleus, which are the plantar flexors, if they are short, will cause firmness in the end field. I'm trying to explain in details because I don't want you to start solving questions if you have not read the content. Because if you only solving questions, that will not solve the purpose. You have to be really good with your content in order to start solving these questions. Now, this slide is just an explanation on the special test of the anterior drawer test, which can be done in either open chain or in the closed chain. But as a movement scientist, as a physiotherapist, I should know how both tests can work and give me the similar results. And on the right side, I am giving you the end fields, the normal and the abnormal, which helps you to understand with examples what structures can be seen with what kind of end fields. Now, this definitely requires a little bit more of the readings, but for this session purposes, I'm just giving you small cheat sheets to understand how you can study and how you can build your basics. Now, speaking of basics, if I say I want you to start working on your basics if you want to pass the exam, you're like, okay, let me go to the basic books. I want to read Kistner, I want to read Newman for kinesiology, I want to read Hole-Meggy, then I want to read Kistner, and then I want to read the review book. It's really not a smarter move. It's really not practical to read 5 books in next 4 to 6 months to pass the exam. You see, for a BPT graduate, we studied for 4 years of theory to become confident starting practicing in India, right? So I would never expect you to read 5 books and then probably start going to the practice exams, which is why I'm going to give you a timetable to study. All right. If you enroll with me in the course, I'll give you the timetable to study and I'll give you everything to read from the course. The timetable is divided into certain topics which are very important to the PCE. It tells you when do you have a lecture, it tells you when do you have a Telegram group discussion, and it tells you what to study and from where. All right, so it saves your time and it gives you a direction to study every day for next 105 days, which is about 4 months, and then you feel ready for the exam. All right. If you are not good with your basics, then we're going to give you all the basic information, audio files, and presentations on all the joints, muscles, muscle origin and insertion, the nerves, the examination skills, and everything, which means you don't have to go back to the books to study anything. Everything is given into the course, and you just have the online access. Whenever you want, wherever you want, you can study your things. Now, when you study and you're like, I don't know if I can use these theoretical concepts into the questions, which is why I'm going to give you 9 different types of quizzes to test yourself weekly basis or monthly basis or the section-wise basis or the segregated one-liners or the post-lecture quizzes to test your information if you're able to apply those concepts into the MCQs or not. And if you don't, then you have direct access to me, to Ruchi, will help you, and other 8 team members will help you to understand how to study well and how to become more confident into that. Perfect. So that was an example of MSK question and how to divide your time and use the timetable. Now I'm going to take you to the example of the neuro question. Let's try to solve a neuro question, and I'll help you to read the question first. Remember the strategy that we did? You want to read the question first. Now, this question says, on examination, the resting position of the eyes are normal with no signs of the involuntary eye movements, drooping of the eyelids, or double vision. Which of the following cranial nerves is most likely impaired? Now, by reading the question first, I understand that I know the goal of the question, that they want me to choose the cranial nerve which is being affected. Now, let's see what do we have in the stem. A 70-year-old female patient is brought to the clinic by her daughter with complaints of bumping into the objects, such as a door or a wall, while walking. She has had 4 falls in last 2 months. There are no complaints of dizziness, loss of hearing, symptoms are gradual in onset. Let's look at what cranial nerves are given in the option. Cranial nerve 2, which is optic nerve. cranial nerve 3, which is oculomotor nerve, cranial nerve 4, which is trochlear, and cranial nerve 8, which is vestibulocochlear nerve. Now, if you remember the concepts we discussed, it says LR6, SO4, rest all by 3. This is a very common mnemonic that we use, which means when you talk about the cranial nerves and their movements, lateral rectus is supplied by cranial nerve 6, superior oblique supplied by cranial nerve 4, and rest all the eye movements are done by cranial nerve 3. Now, one thing to remember when you talk about the movements in the cranial nerves, if there is imbalance between LR6, SO4, and rest all by 3, there will be chances of the double vision. But in this question, they say there is no double vision, there is no involuntary eye movements. The resting position of the eyes are normal. That means 6, 4, and 3 cannot be the right answers, right? So I have option B and I have option C, which can be eliminated out of it. Because imagine if lateral rectus, which helps to abduct the eyeball, is impaired, that means the patient will have eyeball inside. So that's not impaired because it says the resting position of the eyes are normal. Also, drooping of the eyelid is not seen. That means another reason why we have cranial nerve 3 eliminated. Now I have to choose something between option A, which is purely sensory, and option D, which is vestibular cochlear nerve. Now, the main function of the vestibular cochlear nerve is eye and head movement, the hearing, the balance, right? But here they says there are no complaints of dizziness or loss of hearing. That means option D is also not right, which is why option A is the correct answer. Now, you see, it seems so easy when we are solving questions together, right? But imagine the cranial nerves you probably would have studied in second year of your BPT, and you're not a neurotherapist, you're a cardiotherapist, you're a MSK therapist, and you really don't remember the cranial nerves in order, and you really don't remember which is sensory, which is motor, or which serves both purposes. So how do you work on that? You have to study, and we'll give you what are the easy way to study the cranial nerves. Let's read the question number 2. It says, during the evaluation of the patient, the therapist decided to examine the different tracts for sensation of the body. What tracts are responsible for pain and temperature? Direct question. What tracts are responsible for pain and temperature? Now, pain and temperature are sensations, right? So I have to look at the sensory tracts. Option A, anterior spinothalamic tract. Option B says lateral spinothalamic tract. Then you have dorsal column, and then you have corticospinal tract. Now, first thing I want to eliminate is option D because corticospinal tract is mostly motor. And the second I want to eliminate is dorsal column because these are helpful in the cortical sensations like stereognosis, baryognosis, all complex sensations. Then you're left with the lateral and the anterior spinothalamic tract. Now, if you remember the anterior lateral spinothalamic tract, they are responsible for pain and temperature, crude touch and pressure. All right, but if you have to choose one, then you want to choose option B, lateral spinothalamic tract, purely responsible for your pain and temperature, but anterior spinothalamic tract can be responsible for crude touch and pressure, but they are sensory in nature. All right, option A, C, and A, B, and C are all sensory, but because the question says only pain and temperature, then you have to choose very specific. Now you see how PCE can be really basic on the examination skills. And this is what we are trying to build here. All right, this is how you want to remember your cranial nerves. You want to make mnemonics on good things so that you remember how to retain that information for a very long time. For example, on occasion or trust truck X funny, very good vehicle anyhow, every first alphabet of this word will help me to remember what exactly am I looking at for the cranial nerve in a serial order. And when you look at the mnemonic, like some say marry money, but my brother says big brain matter more, every first alphabet will tell me if it's sensory, if it's motor, or if it's sensation, sensory and motor both together. But this is just one example. You have so much of syllabus to cover. And if you go to our Instagram page of PCE Final Frontier, one of our team members, Shivangi, posted a very good mnemonic on the myotomes of the upper and the lower extremity. So we can use nursery rhymes, we can use a lot of other mnemonics to work on our very basic structures. Perfect. I have 2 more questions to go with. Let's try to solve a cardiopulmonary question. Now, this is an intervention question example. All right, it says a 55-year-old male with bronchiectasis diagnosis has heart rate 110, blood pressure 135/86, temperature normal at present, has severe cough producing copious secretions. X-ray shows secretions mainly in the right lower lobe. What will be a good position to clear the airway for this patient? Now, a few things that I know what side of the lobe is being treated. I know the vitals of the patient, and I know that they're looking at good position. That means it's a postural drainage question. Left side lying with 30 degrees head down position, left side lying with 15 degrees head down position, sitting with lean forward and sitting with lean backwards. Now, I think maximum of the Indian physiotherapists are very good with the postural drainage, because when we go to our internship, we are placed in different hospitals and we're looking at the chest physiotherapy. And it was one of my favorite topics or areas to practice while I was in India, because you get the results right away. If a patient, you auscultate certain areas of the lungs and then you're percussing the lung and you're giving chest PT, you get to remove these secretions from the lungs, and it's very rewarding at that particular time. So when you're looking at the right lower lobe, now I know that I have to lay my patient on the left side, right? But also it tells about the lower lobe. That means sitting is not going to work for my patient. So option C and D are gone. Left side lying with 15 degrees head down position, or left side lying with 30 degrees head down position. Now it depends on patient's condition. Sometimes you have to, if the patient's heart rate is 110 beats per minute, right? And the blood pressure is 135/86, if you lay your patient down in a Trendelenburg position, it increases the heart rate and the blood pressure. So you don't want to create those complications. So yes, you want to choose the left side lying, but you also want to control the Trendelenburg position. You don't want to go extreme. So you want to go safely with option B and observe the patient. If the patient shows higher blood pressure and the heart rate, then you want to straighten up the patient again. So you have to be very careful because you got to look at the vitals. And also when you percuss patient, the blood pressure tends to increase. So this is something where you have to make a decision on a clinical basis. It's not just a theoretical world anymore within this question, where you have to choose what position is good for the postural drainage. You have to think clinically, and then you have to also make sure if a treatment that you're giving to a patient, it should be under control and it should not aggravate the situation. So left side lying with 15 degrees head down position would be your right answer. All right, moving on to one more domain question, which is other systems questions. Now, the reason I brought the 4 different domains, because I wanted to give you something from every domain so that you understand, because if you're a ortho PT, then you may not have read the thyroid disorders for a long time, the diabetic disorder for a long time, about the tumors, the type of pain, the nature of the pain. So for the PCE, you really have to go through everything, and the course will help you to go through everything in about 4 months and give you quizzes as well. Let's go with this question. It says a female patient presented to an outpatient physiotherapy clinic with an abnormal blood pressure. Patient has a history of hyperthyroidism and has not been taking any medication to regulate her blood pressure. She's also made complaints of having intolerance to outdoor temperatures. The therapist would suspect low blood pressure and cold intolerance, low blood pressure, heat intolerance, high blood pressure, cold intolerance, and high blood pressure, heat intolerance. Now, how do I make a choice? There are a few things given in this question. The patient has hyperthyroidism, patient has abnormal blood pressure, and patient cannot tolerate outdoor temperatures. Interesting facts about hyperthyroidism, that there's increased metabolism. Now, imagine if a patient with increased metabolism, that means it's fast. If the metabolism is fast, that means you have heat inside the body. And if you're already generating heat inside the body, you will not like to be in hot environment, which is why any option with the heat intolerance would be my right answer. So option B or option D are my closest answers. So I can eliminate option A and option C. Now, what happens when the metabolism is fast? when there's too much heat in the body. When there's too much heat in the body, it helps me to vasodilate my vessels. If vasodilation of my vessels occurs, it lowers my blood pressure. That makes option B as the most correct answer right here. Now, this is the one way to understand by looking at the question, but how if you have to read the concept from scratch? This is what my recommendation is. Try to read this concept from a specific book called Good Man, because it tells you details about the other systems. Now, when you talk about the hyperthyroidism, we talked about the GI effects, right? The gastrointestinal, like there's hypermetabolism. Because there's hypermetabolism, the peristalsis movements have increased. Because their metabolism is too fast, there's diarrhea, nausea, vomiting, and dysphagia. But if the overall metabolism is fast, that means other systems are also involved. For example, CNS, things are going fast. Tremors, hyperkinesis, restlessness, nervousness, irritability. In cardiac, you have high blood pressure, the respiratory rate is higher, but low blood pressure. In the joints, you may have fatigue, pain, chronic periarthritis, and then the patient will have heat intolerance to the environment. So if you go section by section, the effects of the hyperthyroidism, things will make more sense to you, versus if you just go to the book and start reading the normal signs and symptoms. It takes a lot of time. And because this is not our practice to diagnose people for hyper and hypothyroidism, it gets even more tricky to remember those things, right? So you need to build certain ways to remember the stuff, and you need to be more confident about the ways that you're choosing to learn about that stuff. Now, these are the 4 domains that we have already studied in the physiotherapy, but what we do not study in India for the PCE or for any examination is the ethical practices for Canada. So I brought you 2 questions on the ethics. So let's try to solve these questions together. Now, this is the ethics vignette, but I brought you only 1 question. There's a main stem and there's a question and 4 options. It can have multiple questions, like 2 to 5 questions sometimes. But it may not be completely ethical. It may be physiotherapy expertise and the ethics together. Let's go with the question. It says, it's the patient's second follow-up visit, and she demonstrates improvement in pain levels and improved range of motion. While treating the patient, she mentions that that the news of the cancer has demotivated her, and she's very sad, and further adds that she can't live with this pain anymore. What will be your next most appropriate step? Call 911. 911 basically an emergency call number where you call 911. The police and the ambulance respond to that. Alert them about the suspected self-harm. When you hear the keywords like she can't live with this pain anymore, that means it's an indication that they are not happy with their body, and in future it may trigger the thoughts of attempting the suicide. So this is a very serious issue. You want to stop the treatment and call to speak to the psychologist. You want to stop the treatment and ask probing questions. You want to continue the treatment as you don't suspect any suicidal intentions. Well, the patient didn't say, I want to kill myself. The patient didn't say that I don't want this life anymore. But she says she can't live with this pain anymore. So you need to identify what exactly the patient is going towards. What are the next thoughts of the patient? You want to talk more to the patient and want to also empathize and comfort the patient that it may be a temporary phase of your life and you may go through it, right? So you want to ask more questions. Now imagine if you choose call 911. Now this is not an emergency situation and it's the waste of resource. It's very expensive to call 911 because it goes through your insurance. So this is basically a part of the malpractice where you didn't ask appropriate questions and you call 911 and you wasted the sources, and that can be on your license. All right, you want to stop the treatment, but you don't want to speak to the psychologist. You want to refer to the physician, because in Canada, everything goes through the physicians, which means the primary care practitioners, right? You don't want to continue the treatment because there's a trigger, there's a thought in patient's head. And if you continue, which means it may be a lawsuit of the neglect. If patient causes any harm to themselves, you will be in trouble. So these are the ethical values that you have to learn through your journey for your PCE, and will help you to understand. We have ethics classes on separate, and will help you to understand ethics, and will give you questions on ethics. There are free questions on ethics on our course page. If you go to PCEFF, let me just type it in the chat. You will find some free resources on the ethics and the questions as well. So this is one example of ethics question. Let's look at another example. And this is a final question of this lecture, and then we'll give you more details on the immigration and Canadian side. Now, again, we have a STEM, we have a question, and then we have options. The question says, now you see, they're big STEM questions. It'll take you a lot of time to read, and you only have about like 70 seconds to solve this question. So not just reading and solving questions, you have to manage your time, because it's a 4-hour exam, and you have to solve 200 questions in those 4 hours. All right. During one of the patient visits, she is accompanied by the daughter, and while the patient is away to use the washroom, her daughter expresses her concern regarding the mother's condition and wants to know about her recovery. Further adding, daughter mentions that her mother looks sadder and talks very less to anyone in the family. How should we respond to daughter's concern? Do you want to discuss patient's state of mind and give suitable suggestions? Do you want to tell the daughter about cancer diagnosis and that you think the reason why the patient is sad and quiet? Politely refusing the answer to any questions, and suggest the daughter to ask her mother directly, and assuring the daughter that you'll give all details after taking the patient's consent. Well, in Canada, one of the most important things is privacy, right? If the mother does not have daughter's name on her medical charts, if the daughter is not the responsible party or the emergency contact, you cannot give any information to the daughter. You will have to get the consent from the mother to give any information to the daughter. But in India, when we are living in India, our families are very protective about us, and they want, I think, if I go through any medical condition, my parents would know more than what I know, or they may want to hide few things from me because they don't want me to get tense. But it's completely different in Canada. The person who is sick should know maximum. If they can understand, if they have good cognition, they should be the one making any decisions for their life. But it's their choice if they want to bring anyone on board, or they can give power of attorney to somebody who can make decisions for themselves. If the patient does not give power of attorney to anyone, then the patient is the only one responsible to make the decisions. All right. So you want to refuse to answer any questions to the patient, to the daughter, and suggest to ask the mother directly, because the mother is cognitively fine and she will be giving all the information to the daughter. So option C is going to be the right answers. All right. The second step in this answer would be option D, right? If the daughter gets the consent from the mother, then you can give all the information to the daughter. So you have to be very careful. This is very serious offense. If you breach the privacy of the patient, you can go through a lawsuit, which we don't want you to go through. So we'll teach you everything about the ethics, the regulations, and what are the areas where you can make exceptions for the consent, and what are the areas that you really have to get the consent. So this is a part of questions that I wanted to bring. As I said, everything is given on the YouTube channel. The whole lecture will be there, and then you'll have the access to it. So I'm just going to skip few parts, what are considered under the course. I'm just going to be here for like 10 seconds. We have live lectures, we have full exams, we have a lot of bonus material that will give you, so you don't have to have any books to carry with yourself to study for the PCE. And the live lectures are all recorded and given by me and Ruchi, both of us. And if you miss anything, you can go back to the lecture recordings and you can watch the recordings anytime. Once you enroll for the course, you'll have 1 full year of the access, which means if you attended a certain class today, that doesn't mean that you cannot attend it the next cohort. For the 1 year, you'll have the access to the course and you can watch the lectures as many times you want to. All right, so that's on almost my part. If you have any questions, I'll give you my email ID very quickly. And now I think I'll let Salesh go because his expertise would be immigration. Salesh.
Thanks, Ravneet. And I thank IAP to provide me, for providing me this opportunity to present myself here. And when it's immigration process, I would say from the step one, you should be very careful, with the immigration process that you're dealing, and with the immigration program that you want to get into, and with the immigration consultant that you have hired, because it's very important, whom you're dealing with. If the person is not licensed to do this immigration process, especially for the Canadian immigration, then no, the person is called fake consultant, and IRCC has the power to ban the applicant for about 5 years because they have hired a fake consultant. So in such case, you should be very careful, to find out what their license number is and to check whether they are really licensed with the CICC. Now, what you can do is if you have already hired an immigration consultant, you can contact us. The email ID will be provided at the end of this session. So you can contact us and give us the details of your immigration consultant. We can let you know whether the person is licensed or not. If the person is licensed, then really you can go ahead with them. You can really trust them because they are licensed by the CICC and recognized by the IRCC. Now, as you know that the physiotherapists now they should have bachelor's or master's, but just before skipping into that, I would like to let you know that the people, the physiotherapists who are trying to move to Canada in this era, in this time, are really lucky because they can attempt their exam from India itself. That was not available to the physiotherapists before. So I would say up till 2013 or 2014, there was a separate immigration program for the physiotherapists that was available where they have taken about 2,000 physiotherapists per year. And that ended in 2014. So since 2015, so from 2015, there has been no such program. So from 2015 to 2020, whoever have tried, they have been in open competition. So there was no way to come to Canada to attempt these exams and get the license to practice and get the work permits. And at the same time, they cannot swim through the open competition because there were lakhs of people in the pool. It is just not the express entry pool that I'm talking about. There are about 84 immigration programs, but every immigration program has its own rules and regulations, and they have their own eligibility criteria and the selection criteria as well. So from 2015 to 2020, it has been a very tough period for physiotherapists. But from 2021, I would say they have become so lucky that they can attempt the exam from their home, right? And they can clear the exam. Once they clear the exam, they can contact us. And what we can do is we can find out an employer who can offer you a job, and that job we will convert it to LMIA. And after the LMIA has been done, we will apply for work permit for you, LMIA based work permit. And once if you're married, then your spouse will get the open work permit. And of course, your children can accompany you, that is for sure. Now, once you are here on work permits, or even before you are here on work permits, when you get your once you get the work permit, you will apply for nomination for PNP, provincial nominee programs, depending on where your employer is located, right? So basing on that, we have separate immigration programs which we can deal with. Now, once you get the nomination, your PR process will start. So what I mean to say is probably it will take about a year from the day when you have contacted me after clearing your exam. So it will take about 1 year at least to get your PR done, or I would say take it to be maximum of 1.5 years. Okay. So once see your LMIA will be for around 2 years. So you'll be getting your PR within 1.5 years. And once you once you are done with the LMIA, whatever you have promised with the employer, so you have to stay with the employer for 2 years. After 2 years, you can move, right? Now, for a few people, just getting the LMIA job offer would add up 50 points, and probably they might get the PR, ITA, invitation to apply under express entry. That all depends upon the case. But for a few people, that might not be possible. For example, we have dealt with the physiotherapists aged up till the age of 46. So even at the age of 46, we were able to get the nomination. So after they got the nomination, we have started the PR process. And we have also have clients, physiotherapists especially, who are aged below 29, who have done their masters and who have the practice of about 4 or 5 years. And then as soon as they got the LMI job offer, and those 50 points added up to their profile, and that that helped them to procure the invitation to apply under express entry. So it all depends upon the profile again. One more thing, if at all, if you have the proficiency in French, or even if your spouse has the proficiency in French, don't worry what their profession is. Okay, what your spouse's profession is, don't worry about that. If they're good with French, or if you are good with French, then contact us on the day one. From the day one, we can try getting into Canada. So there are francophones, there are French immigration programs. I mean, for the people who really speak French, who are good with French, there are immigration programs separately designed for them. So whatever your profession is, there are high chances for you to move to Canada even before you clear your exam. Or even if you are, let's say if you are below the age of 29, did your masters, and you have around 6 years of practice, and if you are very good with English, then probably you might have some chances. Okay, but I would say most of us are probably at the age of about 29 and who have done their masters or bachelors, whatever it is, and with good numbers of years of practice. And probably you're married too. So at that time, I would say for the people, especially aged about 30 or 32, it's better to clear the exam from your home, because this opportunity was not there before. We had to come here and we had to struggle a lot. And see, once you come here, you will be spending everything in Canadian dollars, not in Indian currency. Whatever you bring, you'll be spending it in probably a couple of weeks or months. So it's very hard to work as a PTA and then preparing for the exam at the same time. Instead, I would 100% recommend to take the classes, clear the exam while you are in India, and get the job offer. And from the day one you are entering, you are moving to Canada. From the day one, you can work as a physiotherapist or a resident physiotherapist, and you are paid for your work. That would be very, very easy. Okay, and coming to the visas, what kind of visa do you need? That all depends on your profile. For example, let's say if you have done your BPT and you are at the age of around 23 or something, so 22, 23 or 24, you're single. So, and if you want to enhance your knowledge, then you can apply for study permit. So we can get you into the colleges. And once you get your seat, we'll also apply for study permit. Once you get the study permit, you can move to Canada on education and you can finish off your education here. See, the 2 years of education generally our people finish it off in 16 months. So in 16 months, you will be you're able to get the PGWP, post-graduation work permit. You'll be eligible to apply for PGWP and you'll get the PGWP. Once you get the work permit, you can start practicing as a PTA if you have not yet cleared the license exam. So what I would advise for these people is to come here on study permit, but still take the classes, clear the exam, so that once you get the PGWP, the work permit, you'll be able to work as a resident physiotherapist. Now, let me give you a simple example. A PTA, physiotherapy assistant, might be paid about $16 to $18, something like that. But a resident physiotherapist is paid about $35 to $40 at least, or if you are on work permit, right? So there's a huge difference what you are earning as a PTA or as a resident PT. So it is always preferred to clear the exam first, because you are a physiotherapist. What else do you want to do here? So you have to work as a physiotherapist. Anyway, you have to clear the exam, right? So, and without clearing the exam, without getting the license, you'll not be able to work as a physio. And there's one more thing. that many people have asked me that, can I come there on visit visa, and can I convert this to work permit? Unless and until you have an employer, you you cannot work this out. And it is also not preferred. It's not a good option to come here on visit visa and convert it to work permit, because you will have to have license anyway. There are so many rules and regulations following it. See, for example, if you are on visit visa, you are not even allowed to apply for a job. You're not supposed to, because you are here on visit, right? So there are so many things that we have to do. So what we can do is, if at all, if you are really, want to work out this PR option or study permit option or whatever, you can contact us. We do the profile assessment and we'll let you know what is the best way to deal with this. And so that you don't waste your time, you don't waste your money, you don't get banned by IRCC, right? And if you are an entrepreneur, you can also invest here on clinics or laboratories or whatever you want to, and you can have your own clinic. And even before you get your license, that is okay. That is acceptable here. So once, if you acquire a clinic, you can come here on investor visa along with your family. So you can contact us for the same too, right? But the best option for most of the physiotherapists, at least 90% of the physiotherapists that can work out, is to clear the exam first, and then get the LMI job offer, get the work permit while you are there in India, and then enter Canada on work permit. That is the best option to do, because that is available right now, right? So I end up my session here. So back to Ravneet.
Thank you, Salesh. Guys, I think it's kind of impossible to talk much about the immigration because there are so much loopholes, and it has to be considered case by case. So you can go to the YouTube and check out PCE Final Frontier, and you can check out the frequently asked questions on immigration that was presented by the Salesh 2 weeks ago. And if you have any questions for me, for Ruchi, and for Salesh, you can have our email IDs, and you can email us anytime. So just take a screenshot of this particular screen so that you have the information about us, and just give us the reference that you attended the IAP's webinar, and you're inquiring about this particular question. But with the time that we were given, I think that should be more than enough for us to tell you what exactly to be done right. Please make sure, and I'm saying it again, and I think Salesh also said it like at least 5 times, don't fall for the frauds. If somebody guarantees you anything, do not fall for that trap, especially for the immigration. All right, perfect. So that ends my presentation, and go back to Dr. Snehal or Dr. Nirali.
Yeah, Dr. Ravneet, thanks, and thanks to your team. So there are a few questions, like someone asked on the YouTube channel. So as Ruchi madam mentioned, about the whole process took 3,833 Canadian dollars. But if someone can't afford this much amount, what are the other ways or any other possibilities, or he or she can do the internship, something like that?
Unfortunately, the application fees has to go through the CAPR, and there are no concessions or donations or scholarships through them. So whatever process takes and the amount that it requires, it has to be paid by the candidate.
Okay.
Yeah.
The next is how much the Canadian license, the PT or physiotherapist can earn monthly?
Salesh, you want to answer that one?
Because I think this is the major
Yeah.
question.
Of course.
Yes,
Yeah,
yes.
this is, yeah, please.
So it all depends on what kind of license do they possess. If they have cleared their PC written component, and if they are resident physiotherapists, they can earn a minimum of $35. It can go up till around $42, $43. It all depends on the place where they are set in. For example, if you take Vancouver, Vancouver is the costliest city in Canada. So the resident physiotherapists there are being paid about 40 to 43. And if you take Toronto, there are too many physiotherapists there. So since it's super saturated there, I would say they are paying about 37, 38, something like that. So there are other places where they are also paying 35. So I would say a minimum of 35 and a maximum of about 43 or something. And if the person is like full-fledged license, for example, they have cleared their clinical component as well, then a minimum starting pay will be $40 per hour. That can go as high as 55. Again, it all depends. If they are paying you 55, you won't be in the cities, right? I'm not talking about Vancouver, because Vancouver is quite different. It's an exceptional thing. Even if you are paid about 50, then it's hard to have a comfortable life there in Vancouver, because everything is very pricey. But other than Vancouver, if you are being paid 50 or 55, then probably you are into what do you say, towns and not into cities. And they're also expecting you to have to possess other skills like acupuncture, acupressure, those kind of dry needling and those kind of things, because that's where the employer can bill the patient. And since they are able to bill the patient, they are also able to pay the physiotherapist. So it depends on their license and the location as well. But for the resident physio, it's 35 to 42, 43 max. And for a full-fledged physio, it's 40 to 55, I would say.
Dr. Snehal, let me make it more convenient for our listeners. So when Saleh says 35 to 40, let's take an average of $37 an hour. The easiest way to calculate, if somebody is getting $37 an hour, that means just multiply it by 2, and that becomes your yearly per annum salary. That means if you're making $37 an hour, it becomes around 37 into 2 is 74, right? $74,000 a year. Okay, because in Canada, it is paid weekly, bi-weekly. So if you're working 40 hours, that's the typical pay scale, like 40 hours a week. So if you multiply 37 into 40 hours a week, that means you're making $1,480 a week. And that becomes 2,800 something for bi-weekly. But the easiest way, if somebody is offering you, let's say $40 an hour, you can think that I'm going to make $80,000 a year. Okay, that makes it very easy calculation for everyone to think of, because then you have to multiply by 40 and then 52. That becomes too complicated. So just multiply it by 2 and add 1,000, like $40 an hour becomes 80,000 a year.
Okay, thanks a lot. So there are the few questions which was there in the, and one more, what are the job opportunities in the Canada?
Well, to be honest, there's no scarcity of the jobs. People get their job. Now, as Saleh said, you have to be very flexible with that. You cannot demand that I want to work in this particular facility, in this particular outpatient, and I can't work anywhere else. People are really flexible here, and you should think of, if you're choosing a specific location to live, you should be flexible enough to drive at least an hour every day, or to take a bus or something where you're taking a job. Now, as Sailesh mentioned, and I'll let him talk about it a little bit more, but when a therapist coming from India should be very flexible, that they may get a good opportunity in the rural areas, not in the cities, because they get more paid. Now, imagine if you have 10 different facilities in this particular area, the pay scale is going to go down because there's a lot of competition. So you need to be flexible and very thoughtful about where you're finding a job and where you're finding a good rate about the job. Sailesh, please go ahead.
Okay. See, when a client, an applicant approaches us, we do the profile assessment. After the profile assessment is done, we'll try to see just not the job offer, but in particular with the immigration program as well. So it's just not the job offer. People ask us, why don't I get it in Toronto? Because it's super saturated. And to get the LMIA job offer, where I have to prove it to the government that there's no one available, there shouldn't be anyone available in real. So I can't just lie to the government. So better to go with the rural areas. For example, there is a place in Alberta where I have offered a job to a lady, a physio. Now that place, she took the job offer, and luckily, we got the work permit and everything done. And after she took the job offer, within 3 months, I guess, that particular rural area was claimed by Alberta government, saying that they have introduced a new immigration program for a couple of areas where this area is also one among them. Now it's literally very easy for her to get the PR, and she's aged above 40. She's 43. So depending upon the profile, though we have the employers in many areas of Canada, we do not recommend everything. What we do is, depending on the profile assessment, we'll say, okay, this is a good employer in this location because this is the immigration program that you can get into. See, when you're coming from outside Canada, if you want to go and settle in the cities, what about the Canadian citizens and permanent residents here in Canada? They don't want to go to the rural areas, right? So I would say, because PR is the one that you're looking for, better to go with the rural areas and serve there to their communities. They're not really very rural. They're towns, not the cities. That's all. So stay there, learn there, get your PR and everything done. After 2 years, you can move to any other place. But again, there are a couple of rules and regulations. For example, if you get your PNP nomination, the province does not want you to go out of the province, but you can move within the province. See, for example, if you're in Alberta, if you're in a town, go to Edmonton or Calgary. So there you have a lot of options. And coming to the number of possibilities and number of options of these job offers, there are too many. But there are very few employers who really want to do the LMIA process, because that's a very tough process. So not many employers are present. So I would say, whenever we give you an opportunity, so better to grab it and get the PR done first. After 2 years, anyway, you can move to city. That should not be a trouble at all.
Right.
Okay. So there's one last question. How long this license is valid?
The license is valid all your life. You just have to keep renewing it with the CEUs. You don't have to take the exam ever once you pass the exam.
Okay, so not like the US, like they have to give the exams with the status changes, right? It's not like that.
No, even in US, you don't have to take the exam for any other state. It's one exam all over the US, and you just have to take once in your lifetime. Once you pass the exam, it's valid all your life, but you have to renew it after every couple of years by doing some CEUs. That can be done online, on campus, in person, it depends. But if you're talking about the US, they have some jurisdiction exams, which are open book exams. It's not complicated for anyone.
So for the Canada is also the once in a lifetime you have to give the
Yeah.
exam and renew it. Okay.
Yes.
Okay. So that's all the questions, and some of the questions are there on the YouTube chat. So Ruchi madam is giving the answers for all the participants, as the YouTube channel is open all the time.
Yeah.
So thanks a lot. So I would like to thank Dr. Ravneet and Dr. Ruchi and the Saileshas for sharing your knowledge for the Canada and PCA preparations. So which is very much important for all the physiotherapy students. And also I would like to thank our state team members and our IIP Digital Media team for organizing and arranging for this platform. Please share your feedback, which is put it in the chat box. So which is very much important for us to make some of the corrections and for your more of feedback. Keep checking our updates, and we are getting some of the webinars, which is very useful for the students. Thanks a lot.
Thank you, everyone. Thank you, Snehal.
Thank you.
Thank you.